The second and deeper layer of the skin, the dermis, is composed of dense, irregular connective tissue that has a lot of collagen and elastic fibers. This network of fibers gives the dermis great tensile strength, which means that it resists pulling or stretching forces. Dermis also has the ability to stretch and recoil easy. I mean, think about how much we move, and when we move, all of our muscles are pulling against the skin. So it has to have the ability to resist excess stretching, but also to go back into place. The dermis is much thicker than the epidermis, and the thickness of the dermis is going to vary depending on the parts of the body, with the greatest thickness, of course, being, again, in the palms of the hands and the soles of the feet. Have you ever thought about what leather is? Leather's made up of animal skin, right? So leather, what we use for belts and basketballs and jewelry and such, gloves, it's the dried and treated dermis of other animals. That makes you think about things a little differently, huh? Alright, so within the dermis we have blood vessels and nerves and glands and hair follicles that are embedded in that dermal layer. The dermal layer is essential to the survival of the epidermis because, remember, the blood vessels that are going to supply nutrients and oxygen to the epidermis are located in the dermis. So when we look at the dermis itself, based on its tissue structure, we can divide it into a thin superficial papillary area, the most superficial part of the dermis, and the thicker and deeper reticular area. So the papillary area is about 1/5 of the thickness of the total layer of the dermis. It contains a lot of collagen and very fine elastic fibers. It is characterized by these little projections called dermal papillae. They're basically little finger-like structures where the dermis pokes up into the epidermis. So all of these dermal papillae contain capillary loops. Some of them will also have tactile receptors called Meissner's corpuscles or corpuscles of touch, which are nerve endings that are sensitive to touch. Some of the other dermal papillae may contain free nerve endings. So these are just different in that they're still nerve receptors, but they don't have a real defined structure, so they're just little free nerve endings. Different free nerve endings can initiate signals that give us sensations of warmth and cold and pain and tickling and itching. The reticular layer, the deeper layer of the dermis, is attached to the subcutaneous layer. So it also has thick bundles of collagen fibers, but fibroblasts and other cells such as wandering macrophages. Sometimes there's adipose tissue that's a part of this layer. The collagen fibers in the reticular layer are more arranged in a net-like manner. Remember I mentioned before, when you hear reticular, think network or mesh. So they have more of a regular arrangement than the collagen fibers in the papillary area. The more regular the orientation of the fibers, the more that particular area of the skin can resist stretching. So the combination of those collagen fibers and the elastic fibers give the skin extensibility and elasticity, which means it can stretch and then return back to its original shape. You see a lot of this extensibility of the skin around the joints and in pregnancy and obesity. So that brings up a topic I want to tie into some clinical connection here, and that's related to stretch marks. So because of the collagen of the dermis, stretch marks or striae, S-T-R-I-A-E, can form, and they're sort of an internal scarring. So they form because there's too much internal damage to the layer that occurs where the skin is stretched too much. So when the skin is overstretched, the bonding between the collagen fibers is disrupted. Small blood vessels may rupture, and that's why the stretch marks sometimes start out appearing very red because of the bleeding into the surrounding tissue. But then later, after scar tissue forms, these sites where the dermis has broken down sometimes appear sort of silvery white. Stretch marks very often occur in the abdominal skin during pregnancy, or sometimes you'll see it on the skin of weightlifters when the skin is stretched by a rapid increase in muscle mass. But you also see stretch marks may accompany obesity as well. But the common thing is, of course, the overstretching of the skin and the ripping and tearing of the tissue. All right, what else do we need? The dermis, of course, is going to be marked superficially, or most superficially at its upper surface, by these little dermal ridges. You may hear them called epidermal ridges. So where the dermal papillae push up into the epidermis, it forms the dermal papillae of the papillary layer of the dermis. So these ridges create a strong bond between the epidermis and the dermis below it in areas of high mechanical stress. Also, the ducts of your sweat glands open on those epidermal ridges, and that's why we leave fingerprints or footprints, because that's the area where those are going to open, or those pores are going to open. So when you touch something, you leave little sweat marks there, and that's what we call fingerprints. The epidermal ridge pattern is determined partly in genetics, but also individually, even among identical twins, there's a little bit of difference in fingerprints because of some of the things that happen during embryonic development. Alright, so that gets you the basis of the dermis. Now let's look at skin pigments and how that relates to skin color. So the primary pigments that are related to skin are melanin, hemoglobin, and keratin. There are two forms of melanin, and each of those two forms is a little bit different in the color of pigment that is made, so it gives different colorations to hair. That's where you see this most commonly. Skin has so many different components to it giving it color that those two forms have a little bit less to do with skin color, and we'll talk about why that's important. Most people typically have about the same number of melanocytes. Melanocytes here you see in the stratum basale are going to create those tiny little granules you see there as little black dots. Those are melanin. And you can also see how there are little projections going up into the stratum spinosum. So that's where the granules of melanin are going to accumulate, and they provide sort of a protective covering over the cells below, which remember are the stem cells for us creating new cells. Okay, so we typically all have about the same number of melanocytes, but what does differ is the size of the melanin granules and the number of the melanin granules that accumulates. And of course, the more melanin that accumulates in the skin, the darker the skin color. There's also some abnormalities of skin color when you have abnormal accumulations of melanin, and that can cause patches called freckles. Freckles are typically sort of reddish brown, and they tend to be more visible in the summer than in the winter. But also age spots, which are very much like freckles in that they're just accumulations of melanin, but they tend to be a little bit darker than freckles, and they build up over time as the skin is exposed to sunlight. Unlike freckles, age spots don't fade away during the winter months, and they're more common in folks over 40 or so. Another abnormality related to an overgrowth of melanin or overabundance of melanin is when you have something called a nevus or a mole. That's typically a flat or round or raised area that represents a benign localized overgrowth of melanocytes. And of course, the more melanocytes you have, the more of the melanin pigment that you are producing. We'll talk a little bit more about moles and skin cancers at the end of this lecture. In addition to melanin causing the skin to have a particular color appearance, hemoglobin, which is the oxygen-carrying pigment in red blood cells, can also cause the skin color to change. When you're embarrassed, you have a lot of blood flow to your superficial areas, and that can make your skin appear red. Light-skinned individuals have very little melanin, and so that also allows the color from the oxygenated blood and that hemoglobin to show a little bit more through, so the blood vessels that you see may appear much darker in very pale-skinned individuals. Keratin is an orangey yellow pigment that gives egg yolks and carrots their color, but it's also a precursor of vitamin A. And so when you have accumulations of keratin, it can be stored in the stratum corneum and in adipose tissue, and that can cause the skin to have a sort of orangey yellow color. You may see this if you eat a whole lot of carrots or red types of vegetables. Alright, so what do we need here? Let's look just briefly at skin sort of as a diagnostic clue. So when you're looking at the color of skin and mucous membranes, that can give us clues for diagnosing certain conditions. When the blood's not picking up enough oxygen from the lungs, someone may appear sort of blue in color. This is usually really noticeable in the nail beds and the lips and any visible mucous membranes, and that's a condition called cyanosis, C-Y-A-N-O-S-I-S. Osis means condition, cyan means blue. So low oxygen, which can happen when you're out in the cold and the warm blood is being pulled away from the skin into your vital organs. You may notice that your fingertips and your lips sort of turn blue. Jaundice is due to an abnormal buildup of the yellow pigment bilirubin in the skin. This sort of gives the skin a yellowish appearance, and the whites of the eyes may appear sort of yellow as well. And this may be indicative of liver disease, or in infants, just an abnormal breakdown of the bilirubin and accumulation of that. Usually this is going to fix itself in the infant. However, with liver disease, it may be a little bit more serious. Let's see. Pallor or paleness may result when a person is in shock or anemia, and this is more easily observed, of course, in people with very, very light colored skin. And typically what you see there is a very sort of translucent paleness, and this may be when anemia has developed and there's not enough hemoglobin, or other conditions that cause the system to be in shock. Alright, so brief overview there. Let's move on and talk about a couple of other conditions that are related to pigment and skin color. Albinism is an inherited inability to produce melanin. So most albinos, or people that are affected by albinism, have melanocytes that are just not able to synthesize a precursor molecule called tyrannase. Tyrannase is of course going to be a major part of producing melanin. So if you can't produce the melanin, then the hair, the skin, the eyes all appear very, very pale. Another condition called vitiligo is the partial or complete loss of melanocytes from certain patches of skin. So not throughout the entire body, as you see with albinism, but just in particular areas where it produces irregular white spots. This is usually related to an immune system malfunction, where the immune system is producing antibodies that are going to attack the cells, the melanocytes that would be producing the melanin. The hypodermis, remember, is not a layer of the skin, but we do consider it when we're looking at the skin because it's the layer just adjacent to and attached to the dermis. So in the hypodermis you have a lot of fatty tissue, and that of course is going to attach the skin to the underlying organs.